My name's Eli Cahan. I'm an investigative journalist. I'm also a physician. I write stories at the intersection of health policy and public health with a focus on child welfare. I've filed records requests with every state across the country. I've had conversations on and off the record with a number of departments of insurance within various states. People with eating disorders are getting routinely denied the care that they appear to be entitled to under the law, that appears to be illegal in most of these situations. There does not appear to be any relevant or significant enforcement of the law, and that all distills into a situation where people in the throes of serious mental illness are asked to be their own self-advocates in the face of a broken system. It's quite a sensitive area, Eating disorders are terrible diseases, really debilitating for folks. And thankfully, there were and have been a couple amazing, courageous, inspiring people who have been willing to share their story knowing that, or hoping that it can serve greater good. I think the number one thing is to remember that at the bottom of every statistic is a human being who's affected. There are laws on the books that we could carbon copy tomorrow that could try to promote, reinforce, assure people who live in this country that they can get the care that they need. Biggest impact that the fellowship had on me was really unlocking the world of mental health by exposing me to speakers who are real experts in their respective fields. And the number of times that I've turned to my co-fellows for advice or support or pep talks or camaraderie, those kinds of connections are completely indispensable and have been incredibly impactful in terms of guiding not only the stories that I do, but really how I do them.